Well, even prior to the pandemic, healthcare workers were at higher risk of suicide compared to the general population. But now experts are voicing concerns that the growing pressure from COVID is having serious effects on their mental health. Despite government support measures during the pandemic, those on the front line are still reluctant to seek professional help. Continual surveys have found high rates of burnout and that many frontline workers currently have moderate to high symptoms of PTSD. Clinicians say the sector risks losing staff if further government intervention is not taken to address the mental health issues. The Drum's Stephanie Boltje explains.
Chloe Abbott was a fourth-year doctor in training. Her sister Jessica says when Chloe wasn't working, the 29-year-old was studying.
A lot of the time we thought that Chloe was really thriving because she was really dedicated to her work.
But she kept her struggles hidden from those closest to her.
She wasn't accessing help early in the piece when she really needed it, and we do know that she was one of the people that was concerned about the implications of accessing help. You know, it wasn't until we'd lost her that we, really truly understood everything that she had been coping with.
Chloe's death and that of other doctors in 2017 forced a conversation about mandatory reporting in the health sector. But nearly 5 years on, and in the midst of a pandemic, those on the front line say the stigma remains.
We're seeing burnout rates within hospitals higher than we ever had before. And we really need to focus on why healthcare professionals are killing themselves, because they feel like they have no other choice.
A change in culture is still needed. The Australian Medical Association says there remain high levels of bullying and harassment.
I don't think anyone or any doctor or any nurse comes to hospital thinking, I'm going to be a bully today. Really, it's that environment, that kind of pressured environment which leads to problems.
During the second wave, a national survey of nearly 8,000 people, including doctors, nurses and admin staff, created by clinicians themselves, found more than 60% reported being anxious. 5% said that they had PTSD before COVID, but based on screening, 40% actually had moderate to severe symptoms for it. More than 70% of the respondents were burnt out and had a high degree of depression.
I've had to work incredibly flexibly, picking up workloads that would never normally be my role.
I feel like my strengths weren't put to use. I didn't have a voice and was expected to step up and step in line.
The most common coping strategy was exercise, but upping their alcohol intake was another. Still, only 40% sought professional help for depression, anxiety, or thoughts of suicide.
We don't want to see any other families that have to go through what we've been through over the last nearly 5 years, having lost a loved one this way. It's simply awful, and it changes your life, and it changes your life in the most awful way.